11-year-old male. Unfortunately, we don't have any clinical information about him. This is the MRI of the patient. Here on sagittal view, we can see there's a lesion, a tumor, occupying the region of the pineal region, or the middle posterior part of third ventricle, basically the pineal region. And this is with contrast. So with the intense enhancement of contrast. And here's axial view. It's a rather large tumor. And this is a coronal view, the tumor occupying the pineal region with intense contrast enhancement. And this is T2, MRI T2. We can see that inside the tumor there are many small cysts, and then there's a good cleavage CSF plane between the tumor and the CSF, especially on the right side of the tumor. And here we can see this is dark spots inside the tumor that could be at this stage could be big vessels inside the tumor or calcification. But we can see here the vein of Galen, straight sinus over here. And this is the patient's angiography. This is vertebrobasilar cystin, in which you can see this almost a midline lesion, a blush of the tumor over here. And here is a lateral view. You can see that even here, AP view, you can see during the arterial phase, we can see already the vein of Galen. And here on the lateral view, still on the vertebrobasilar angiography, we already see the vein of Galen and then straight sinus. So this is a big arterial venous shunt in this tumor. And we can see this tumor is supplied by, this is the posterior thalamoperforating arteries supplying the anterior inferior part of the tumor. We can see this is the roof of third ventricle. So on top, this tumor has to be supplied by the medial posterior carotid arteries, and obviously there will be other branches probably from the superior cerebellar artery to supply, especially inside the cerebellum mesencephalic sulcus, to go up and supply this tumor from behind and laterally. But once again, during the arterial phase, we already see the veins. So there's a very quick arterial venous shunt here. So this patient will undergo in a semi-sitting position, a supracerebellar approach to the pineal region. So now let's go to the video. Once again, this is preoperative. We have to check the angle. This is angiography, lateral view, and this is supracerebellar approach. The patient is in semi-sitting position. So the bridging veins has been coagulated and cut. This is combing, and now opening the arachnoid membrane to recognize what's tumor, what's normal tissue. And then here you can see the tentorial incisura on one side, tentorial incisura on the other side. This is a precentral cerebellar vein because it's located ahead of the central lobule. So that's why it's precentral cerebellar vein that's been coagulated. This vein has been named as vein of the cerebellum mesencephalic fissure. Now it's dissecting on the right side. The white structure is the tumor here, and he has to establish a good dissection plane between the tumor and the normal tissue. So all this is tumor. This is open the tumor. This is inferior, middle to the inferior part. Now he's dissecting over the midline towards the left side. And check, this is the vein of Galen. So he has to separate the vein of Galen. Vein of Galen and the internal cerebral veins and basal veins, that they all have been pushed upwards. So you have to separate carefully what's tumor and what's the those important veins. Those important veins are all here above the tumor. So he's doing a very careful dissection, cutting, sharp dissection. This is a normal tissue. This is tumor. So he's establishing the limit, the dissection plane between what's the normal tissue, especially those important veins, from what's the tumor. So veins have been pushed up above, pushed superiorly by the tumor. Now dissecting, now it's coagulating. As we remember, there are many, we can see in the angiogram, this tumor is rather highly vascularized. So he's continue to cut and coagulate and trying to establish what's the tumor, the plane between the tumor is here and this normal tissue and the veins above. So he's dissecting carefully to separate what's tumor, what's vein above. So this is a normal tissue, this is tumor. So he's trying to separate, dissect them. Now once again, it's on the right side. Something bled over here. It's right at the midline right now. It's sometimes in a semi-sitting position. It's not easy to reach the inferior part of the tumor. You have to depress a lot the tentorial surface of the cerebellum in order to get to the lowest part of the tumor. So he's coagulating because we know the tumor is very, very vascularized. So he's pushing the tumor upwards so he can get to the most inferior part of the tumor. Now he has dissected circumferentially the tumor and is pulling out, so the tumor is coming out, and this is the aspect after surgery. You see this tentorial surface cerebellum, and this is the post-op MRI, corona cut, axial cut, and the sagittal cut. You see the internal cerebral vein has been preserved here. And once again, the post-op MRI, sagittal cut, corona, and axial, showing that the total removal of the tumor. And the histology was teratoma.